Thank you, Asim, and thank you, David, for the invitation again. That was a long morning on my side because we started 6 o'clock in the morning on this side of the world. I will give you some brief information on what you need to do during the COVID-19 pandemic as a laparoscopic surgeon. Everything is actually well explained, and I cannot actually change my slides now. Can someone help me to change the slides? Yes, I can do that now. We published 2 papers on the what you need to do as a surgeon during this pandemic. You can actually get an access on that papers through the connection I am showing here now. And also you can follow the guides as shown by other speakers on what you need to do during laparoscopy. But I have to say that that's all are being changed now, and there are some changes on the guidelines as well, so you need to check regularly on the websites. And what I will do now is I will show the video of how you need to get ready for the operation and which kind of equipment you need to use during preparation of the surgery. And as you can see here, we are using this is a gown, special gown. This is my assistant professor. He's taking this preparation, putting the guide on, and he's using N95 mask. And as you can see here, he covered everything. He's gonna have the glasses, goggles, on top of the mask. We always use boots, and we will put another mask on top of N95, and he's gonna have special cover on Google as well, and then scrubbing up using brushes, and then the getting ready for the procedure. It's all regular that you are doing every day, and then he's going to put the apron on the special gown and get ready for the operation. So we're going to use double layers of the gloves for the operation. It's important to cover and to protect yourself from any kind of contamination. And when you're finished, you need to take everything off in an order. And you need to leave the first layer in the theater, in the special bin in the theater, and then take the other layer outside of the theater. So you can see here, he's taking these things outside of the theater. And after taking the special white cover, he's gonna take his scrubs outside the theater. And then he will finish cleaning and changing all that equipment, and he will leave everything in a special bin to discard. So this is the video that you can use and check regularly. And I'd like to thank Emir again for this preparation for this video. And if we get a summary of what we are using as a special equipment, as you can see on this slide, which is already spoken and given details of other speakers, I will not go through that. I would like to talk about how to protect the leak and the virus contamination in the theater during laparoscopy. We have some special industrial available, commercially available systems, but they are quite expensive. As you can see, this is from CONMED and this from Etikon, and the other one is from Stores. But if you don't have any kind of this equipment available in your theater, do not worry. And what we are doing in our side is we are using this MF line that we are using in the wards and in the ICUs to connect our trocars to suction irrigation bin, which is filled up with a disinfectant, and all the CO2 during the procedures, if there's any leak, will go inside this bin, which will be discarded after the operation anyway. So you can You can follow the photographs, and I will show you the video in a minute. You can follow the photographs, and you can see how we made the connections here and how it is connected to being outside. And you can see that there is no leak on top of the suction irrigation special bean here. And I will show you the video how you need to desufflate the patient. When you finish the operation, before you start desufflating, and when you finish desufflating, before you take your trocar out, you have to close the line by using special staple and make sure that nothing is going to go outside, as you can see here and here. So this is this short video to show you how to take your trocars out and how to take your camera out after desufflation in order to avoid any contamination through the CO2 coming out into your theater. And it's much more cheaper than that kind of systems, and it's quite useful. So when you finish this, you will see inside, and you will check the trocar size first. After desufflation, take your trocars out. No air left inside. It's already disconnected from the insufflators. So you are seeing that we are taking trocars out by seeing through the camera. And then at the end, the last one is the camera trocar, which needs to be taken out properly. Okay, and then when you finish it, you will see that there is no leak outside. So this is the summary which is already given by other speakers. I will not take your time to go on through that, but I would like to press on this paper, which explains the rate of death in patients undergoing surgery during the incubation period of COVID-19 infection. If you check this paper, you will see that the rate of death is around 20%, 20.5% in the patient, but it's especially increased in patient with pneumonia. The death rate is around 50%. So you have to cancel or you have to postpone all your elective operation during this period of time in order to avoid unnecessary results and lose your patient. So this is the summary. Again, this is the summary how to choose which kind of surgery and how much actually you can delay that kind of surgeries. It's already shown on the table. You can check through that paper published by Style on patient safety in surgery. I'm not going to go through on that, but I would like to mention about our study, which is being run since the pandemic started. Most of the health personnel in my hospital is actually participating in the study, and study is actually going to be given to bigger population now. What we are doing is we are using pleconil 200 milligram once every 3 weeks, which is combined with vitamin C, vitamin D, and zinc. 3 of them are actually available in one drug from Bayer, Redoxon, effervescent, once every day. So 120 participants by now are using it. Most of them are actually personnel, healthcare personnel, and doctors and nurses, and their first degree relatives if they want to join. So we haven't seen any infection by now, which is 2 periods of time is already gone, and they're going to have 2 or 3 more periods. We checked them by using a rapid test, and I have to say that no one is infected. And I'd like to thank Asim and David for giving me this opportunity once again by showing you a great picture from Istanbul, and would like to have you all in Istanbul after this terrible time passed on. Thank you very much, Asim.
Thank you.